The following program is sponsored by El Camino Hospital in partnership with Blue Orchid Press.
Heart disease is the #1 killer in the United States. If you're not paying attention to your heart, it's time to start. Hi, I'm Nurse Barb, and I'm here at El Camino Hospital with your daily dose. When it comes to hearts, no two people are exactly alike, nor are there risks for heart disease. So you were hiking, you had some chest pain, and severe. What did it feel like?
It was a pain that went right through to the back, to my back, but it went away immediately.
It went away, and so you
I
just kind of rested?
I did have a little bit of numbing in the left arm. I could tell that a change had happened.
Many of us associate heart disease and heart attack with crushing chest pain, but there are other symptoms you need to watch out for.
Everybody should be really in touch with their body and take care of their body. They should exercise regularly, they should eat a proper diet, and they should not be too overweight. I think the first thing to notice is that are these symptoms precipitated by exertion? So if they're exercising and the symptoms get worse, one should be very suspicious that it's related to their heart.
Sylvia, even with crushing chest pain, did it ever occur to you that that might be a heart attack?
No, it didn't. And the fact that I've done a lot of running in the past, and when you overexert yourself, those kind of similar symptoms, you can feel pressure in your chest and your hands tend to tingle and that sort of thing.
Many women think this can't possibly be a heart attack. It's just not painful enough, and it doesn't strike them as dramatic enough. But if the symptoms go on for 15 minutes or longer, they definitely need to just call 911 and get to the nearest emergency room.
Genetics can play a significant role. Find out if you're at greater risk.
Most of us are aware of diabetes as a big risk factor, tobacco as a big risk factor, high blood pressure, or what's known as hypertension, as a risk factor, and of course, high cholesterol.
Are there any ethnic groups that have higher risks of cardiovascular disease?
There are a lot of Southeast Asians, and for some reason in that area there are genes that are associated with risk factors for coronary disease, and so we see very young people who are coming to the United States and their lifestyle have changed and they are great risk for having early coronary disease.
Pay attention to any signs and symptoms and make heart-healthy decisions.
If I was to pick one diet, it would be a Mediterranean style diet, and that diet specifically has lots of vegetables. So I tell patients to focus less on the total amount of fat and more on the type of fat.
I think lifestyle modification is still the first way to approach this condition. I always tell my patient, do anything you want so long as you continuously do it for at least 30 minutes, 5 days a week.
Taking care of your heart also means being prepared. Find out what treatments and resources are available.
You should talk to your primary care provider about doing a routine evaluation, including a blood pressure evaluation, have their cholesterol checked, and make sure they get checked for diabetes, particularly if they have a family history and as they get older.
Do your homework. Don't leave your heart health to chance.
Time is of the essence. This is why it's so important that patients go to the emergency room and call 911. The 90 minutes is important because we're trying to reduce the size of a heart attack.
What would you tell women who are experiencing these kinds of symptoms? What would your advice be?
Well, I would say don't ignore it like I did. I think I was very lucky.
So remember, be good to your heart. Assess your risk factors, including your genetic makeup and family history. Know the signs and symptoms of a heart attack. Make heart-healthy choices and find out what treatments and resources are available to you. And as always, get the information you need to make the best decisions for your health and the health of your family. I'm Nurse Barb, and this is your Daily Dose.